What is COVID-19? The 2019 coronavirus, also known as COVID-19, is a type of coronavirus that is transmitted from person to person through direct contact or contact with viral particles on inanimate objects. Coughing can cause viral particles to pass through the air, and they can live on certain surfaces for up to 72 hours. This particular virus is so contagious and spreads to other countries so rapidly that it is considered a pandemic of a similar magnitude to that of the 1918 influenza pandemic 1. Through genome sequencing, scientists determined that the virus came from a bat species known as the horseshoe bat. 2 Various factors can cause viruses to mutate, and, when COVID-19 mutated, it spread to another species. Scientists still do not know who this second species is, but they suspect it is a pangolin or possibly a fish. But when the virus mutated once again, it became able to infect humans. A similar viral mutation occurred in 2009, when more than 50 countries experienced cases of swine flu. People infected with COVID-19 may remain asymptomatic for several days before starting to show signs. As these signs are mainly respiratory, patients with COVID-19 may initially think they have the flu or a cold. Many infected people have recovered, but COVID-19 has been shown to cause respiratory failure even in the healthiest patients, and it is capable of affecting people of all ages. 1. Can dogs contract COVID-19? COVID-19 is only one type of coronavirus. Prior to COVID-19, most veterinarians considered coronavirus in dogs to be canine coronavirus or CCOV. This particular variant causes short-term diarrhea that may be mild in adults but moderate to severe in puppies, and may mimic another severe gastrointestinal disease known as parvovirus. CCOV is highly contagious and spreads through contact with feces. At the beginning of the COVID-19 pandemic, experts were not sure that dogs could contract COVID-19, but warned that people with respiratory signs should stay away from other people and animals. After all, a viral mutation has allowed COVID-19 to pass from an animal to a person. Does that mean that the opposite is possible? At the time of publication of this article, there is no evidence to suggest that dogs play a major role in the spread of COVID-19. However, there have been a few cases where dogs have tested positive for this disease, and they usually come from homes where their owners or family members have been infected. One example is a pug named Winston from Chapel Hill, North Carolina. Its owners were infected with COVID-19, and then one day Winston showed mild clinical signs such as sneezing, lethargy, and skipping a meal. After a few days, he recovered and is considered the first dog to test positive for COVID-19. None of the other animals in the house were affected. Cases of dogs tested positive for COVID-19 are still very rare, but if you are infected, you should avoid contact with family members, including your canine companions. If you think your dog has a respiratory illness, contact your veterinarian immediately. Remember to tell your veterinarian's office if you have been infected or if your dog has been in contact with an infected person. Your veterinarian can contact the state veterinarian for additional advice on how to test and treat your puppy. Can other pets be infected with COVID-19? Dogs aren't the only species affected. A few cases have been documented in New York, and at the Bronx Zoo, some of their tigers have been infected. Scientists hypothesize that one of the zookeepers who was infected with COVID-19 passed it on to the tigers, who eventually showed clinical signs associated with respiratory diseases. This is the first case of animals tested positive for COVID-19 in the United States. 1. How to protect your pets from COVID-19? If you practice social distancing, your pets should do the same. The ideal is to stay at home and away from others. However, you can walk around your neighborhood as long as there is enough space between you and others. Avoid crowded places such as dog parks and dog daycares. If you know someone who is showing signs of flu, it is best to avoid contact with them. Sick family members should quarantine in a room in the house to avoid passing the disease on to others, which also means that pets must move away from it. If you start showing signs, ask other family members to take care of your pet or consider entrusting it to someone else for a while. If your pet starts showing signs, contact your veterinarian as soon as possible. Underscore underscore underscore. While COVID-19 remains a serious public health problem, our pets are still considered to be at low risk of contracting it. However, this does not mean that this is not possible, and there have been a few cases of dogs, cats and even tigers that have tested positive.